Hey guys, know it's been a while since I did a video. Sorry it's been a while since I did a video. I just wanted to come to you now, and it's November the 4th, which means it's one day away from my anniversary with my lovely husband, and we just got back from staying on the houseboat, which is graciously allowed for us to go there by Patricia and Dawn, our very good friends. And basically it is November season, as I like to call it, Scorpio season. And I've got a birthday coming up. There's a lot of things going on, and I'm sorry it's been a couple of weeks since I've been on. And I'm sitting outside with my friends, the scarecrows, because it is appropriately fall right now. So, just wanted to touch base with you. If you hear some background noise, it's probably traffic going down the road. But I just wanted to come in and basically sum up my experience with breast cancer surgery. I think we basically had gotten to the point where, you know, we were talking about how you wanted to battle it surgery-wise, because surgery is really, honestly, surgery and then chemo is basically how you handle it medically. However, there are residual effects from all of these things, which I'll go into later. But the best part of actually recovering from surgery, as it is with most surgeries, is they give you these really great narcotics that basically keep you stoned and happy for several days or weeks. And so I do not condone taking them. I do not condone taking them unless you have severe chronic problems on a daily basis at all. But I do, however, support the administering of those drugs when you're coming away from surgery, especially. I mean, what would we do if we didn't have anesthesia, guys? What would we do if we didn't have some kind of pain relief, honestly? So just be careful. Be very careful when you're dealing with narcotics, especially. But they do kind of keep you comfy while you're recovering and healing from all of those things. Now, what comes next is, in my particular issue, my particular tumor, it was hormone positive, so they put me on a drug called tamoxifen, which a lot of times is prescribed for you to take for several years. The reason is it's a hormone blocker, basically, to put it simply. And it will help block the production of estrogen in the body. At least it helps keep it from feeding any tumors or cancer cells that might be hormone positive, because they will test your tumor and it will either be hormone positive or hormone negative. Also, I encourage every woman and man that's going through breast cancer to get the test for the BRCA gene to see if you actually have that gene. And if you cannot afford that test, you can appeal to and actually get help from the federal government on covering you on the cost of that test. If you meet a certain income bracket, they will help. There's a lot of help out there, guys, for breast cancer especially. So I highly advise you get that, just to see if there's a possibility that's going to come back. And, you know, it increases your chances. It doesn't mean it's going to happen, but it increases your chances if you have the gene. I did not have it, luckily. So I'm hoping that I'm good. The fact that I had both of my breasts taken, and they also took the nipples, and I'm just going to be frank, they do that because most of the tumors that grow within the breast originate in the ducts of the milk ducts of the breast, which are right there, right in conjunction with the nipple. Obviously, that's how you feed a baby. So they will take your nipples very often. And that, quite honestly, guys, was the hardest thing for me, was losing my nipples. I mean, for all kinds of reasons. I mean, I'm just being very personal with you now in saying this. However, the plus side to having your nipples removed is that you don't have to wear a bra, like, ever again. You really don't. You're never going to have an issue with pokage, ever. And there are actually alternatives. If you absolutely positively cannot live without them, you can have them cosmetically placed basically back on your breasts. You can wear prosthetics. There's all kinds of options as well for that whole thing, because really, aside, I knew that the hair loss was temporary. I knew, a lot of the stuff was temporary, and I knew I'd have scar tissue, but I also knew that I, was going to get implants, so I would have 2 lumps on my chest that looked like breasts. But the hardest part was having those removed. So once you've adjusted, just keep pushing forward and decide what makes you happiest when it comes to that. Okay. So basically, after I, recovered, I went through 6 chemo treatments, about 3 weeks apart. And I got through that first chemo treatment that was hellacious, and found out I was allergic to one of the drugs. It was horrible. The first one was just horrible. And, when they started administering, because they give you a series of 3, and then, one comes down the tubes first when they hook you up. I never had to have a port either. I had it directly into my arm. And so that was a good thing, because ports sometimes can get infected, but don't think that they're a bad thing. If they can't do a vein or they keep blowing your veins when they give you chemo, go for a port. Anyway, so when you have that and, they're giving you the chemo, they give you, again, paperwork, and they describe exactly what's in these 3 drugs. Now, they have actually come up with some revolutionary treatments that are awesome for battling cancer, basically any kind of cancer. But these standard drugs that they give you for chemo are basically almost always the same 3. And they did this for me as a preventative measure because I had 2 infiltrated lymph nodes. And so that means that it was circulating, cancer cells were circulating my lymph system, and they needed to kind of go in there and make sure that they weren't going to spread. So again, they hooked me up. They gave me the first drug. That was okay. Second drug, that was okay. Third drug, and then I felt terrible that first 2 weeks after chemo. I mean, even my doctor's like, Penny, you're not supposed to feel this bad. So anyway, we figured out after the second chemo treatment that one of the drugs, once it started entering into my vein, caused a pulmonary, it was basically what they called a pulmonary hypertension reaction. And immediately knew what was going on, ran over and shoved more Benadryl and more steroids down my IV, and Dr. Webb came in and said, pull that out, you're not taking that anymore. So after that, I only got 2 chemo drugs, but one of the ones is called the Red Devil that they almost always give. And it's also the one, I believe, that makes your hair fall out. So, of course, I still dealt with that. But I go through chemo, I start, experimenting with makeup, and I start, since it was winter for me, I could wear headscarves and not get too hot. And, just started messing around with like big earrings and, just trying to make myself look as beautiful as possible. Just to kind of help me get past the whole having no hair thing. But honestly, guys, bald is beautiful. Bald is beautiful on men. It can be beautiful on women. It doesn't mean that, it's not an automatic ugly sentence for you to, oh my gosh, you're bald, so you're automatically ugly. No, absolutely not. Absolutely not. So embrace that and just embrace those looks. And if you would like to see any kind of ways to wrap your head in scarves and any ways to dress yourself up, make yourself look like kind of a biker, pseudo, gypsy, then I'll be happy to express and show you ways of doing that. I'll be happy to do that. So basically, to sum it up, after that many months, more or less, about 5 months of chemo, 6 treatments, I went in and had reconstructive surgery and had implants put in. Now, here's where I'm going to tell you. When they go through this and they put space maintainers in your chest and expand you over time to help keep skin loose for implants for later, then they put saline in there. And saline is actually it helps build up the breast and is formed better as far as that, but it's very, very firm. So we had major jokes like my breasts were like, they were like robotic breasts or something, or they were like, we were calling them, I think, Terminator breasts, because they were very firm and just basically could bounce a quarter off of them. So, because over time, the saline expands your chest cavity and helps your skin accept implants after, a period of time, because they let you heal and they, let everything chill. You go through chemo, that kind of thing. At least I elected for this this method. I didn't want to do it all at once. There are women that have done it all at once, but I opted for having reconstruction later, because I wanted to recover from the double mastectomy first, or bilateral is what it's called. Anyway, the saline was honestly the best way that, they could do that. And then when I went into my plastic surgeon, he said, you can do saline implants or you can do silicone. Well, silicone feels more natural. But what they don't always tell you is that after breast cancer and after they've removed your breasts and your nipples, then you basically have skin flaps. You don't have breasts anymore. You don't have what I would call normal, sort of rounded breasts, and you don't have that cavity. It's not the same. It's just not the same. And I'm going to advise all of you that if you want to get reconstruction, please get saline implants so that they hold their shape better. These silicone implants definitely feel like real breasts. Like I can squeeze them up and move them around, and they look and feel like real breasts. But there's a little bit of a downside, and I am going to try later on to get mine redone. But a little bit of a downside to that, because of the fact that you don't really have that breast cavity anymore once they've taken your mammary glands out. You just have these skin sacs, more or less, just to be crude. So you want to have as much form-fitting, or as much of a capacity for, looking like you have breasts within those skin cavities, for lack of a better word. I know this all sounds horrible, but anyway, you want to inflate those sacs out right, and you want them to stand up and be a little more firm. Make sure that your plastic surgeon is advising you. I had a great one, but he did all kinds of stuff. He didn't just work with breast cancer patients, and I've just learned these things. I'm not dogging him or his work, but I've just learned these things as, you do when you're experiencing. So saline is the way to go, in my opinion, unless you have this, really, really just exceptional plastic surgeon that knows a bunch of tricks on how to make silicone behave. Because, honey, listen, silicone caves in. Silicone moves around. It does not just sit in place. It really doesn't. And so, yeah. So that's what I'm dealing with now, but it's okay. It's fine. It's the fact that we actually have the option to get reconstruction that's wonderful. And I applaud all those women that have elected not to do it. They honestly are braver souls than me. I was not ready to give up my femininity or what declares my feminine presence with breasts, but they were, and more power to them. I just think that's fantastic. I still have notions of getting a tattoo to cover my scars as well, but I really don't feel that insecure about my breasts, honestly. I mean, as far, I don't know, I'm back and forth, and like they actually took pictures for a folder with my plastic surgeon. They actually did ask me, is it okay if we use these in our material? And I'm like, sure, I don't care. I mean, if I can help somebody else with any example of what I've been through, I'm happy to do so, honestly. I don't have a lot of inhibitions about showing my breasts, but it's definitely, they're not what they used to be. They're just not, but I got them. So, fake or not. It's like, yes, they're fake, but the real ones tried to kill me. All right, guys, so that basically sums up the surgery aspects and some of the hints that I wanted to give you and some of the tips I wanted to give you, the advice, just from my own personal experience. If you have any questions, please put them in the comments below, and I'll be happy to answer. And if you want to see more content from me, instead of just me running my mouth for 15 minutes, then let me know. Let me know what you want to see, and I'll be happy to incorporate anything I can. I'm still playing around with editing on these videos, guys. I'm not good at it, and that's okay. I don't have a lot of time. I'm taking care of my mom. I'm planning on going back to school online after work. You know, got a lot of stuff in the works. The holidays are coming up. We're in the busy season at work. So I'm just trying to put it out there as I can. So I do appreciate your patience very much. So anyway, hit me up. Let me know. Let me know what you want to see. Nod to my company, Community Connect. Woo, love ya. Love the Owen family. And anyway, guys, you know what? Have a great, beautiful fall day today. It's like 65, 70 degrees here. Crisp and low humidity. The lake was wonderful. We had a great rest, and I hope you guys had a great weekend. So I'll try to post as soon as possible. Have a good one, pink ladies.